Are you looking for a way to help you and your family save money on healthcare? Direct primary care may be the answer.
We're Shannon and Michael. We are with Healthcare Genius, and today we want to talk to you about direct primary care, who might benefit from having access to it, and kind of what it means. Our first question here, what exactly are we talking about?
What is direct primary care? It started out, I think, as concierge medicine. You had a lot of doctors years ago decide that they were tired of dealing with insurance companies. They didn't want to do billing. They didn't want to hire the staff. And they had a big enough clientele that they decided to start charging them a monthly fee or an annual fee. And then you would have access to the doctor whenever you needed it. It's kind of sprung up. Those were traditionally higher cost programs. So again, for higher income individuals would utilize those. It's moved down to where there's a lot of plans out there that have access to these doctors as well, but you can do it at a much more affordable price.
So this is actually a viable option for like your everyday person.
It absolutely is. And when you think of, so the idea is that you pay a monthly fee, and again, you have access to that doctor. You may have to pay a small copay every time you see them, but it kind of goes back to the way medicine used to be, where you could call up your doctor if there was a problem and see them. The way medicine works today is a lot of the primary care doctors have to see 30 people a day just to stay in business. So this way, these doctors can spend more time with you and can get to know you, and you have that access. And again, you can make this just for yourself, or you could use it for your family members, so that everybody has access to that physician. Here in Colorado, we probably have at least 3 or 4 different models and different practices that offer this. But we see costs somewhere in the $60 to maybe $100 a month range for an individual. When you pair that with a high deductible health plan, it can be very attractive as a way to save money over plans that are traditional where you have copays built into them.
Yes, and this concept doesn't include like if you have to go to the hospital, for example. So it's not necessarily an either or, right?
That's exactly right. It's not going to cover you for that. You still want to have health insurance, but in certain areas of the state where healthcare costs are really high, this can be a fantastic way to pair the primary care with that high deductible plan. You'll still know what your worst case scenario is, but you have access to that doctor. And one of the things that leads to a lot of higher cost illnesses is people not going to the doctor.
Yeah.
Not getting things checked out because they're afraid of what it's going to cost.
Which long term can make your healthcare costs way higher. Next question for you is, if you're interested, where do you even find these doctors? Kind of what's step one? Where do you start?
So we have a link and a website that we've set up that offers at least one program here throughout Colorado, and actually throughout the country, where there are doctors for this. You might check with your employer. Some employers are starting to offer direct primary care, but there's 3 or 4 others. This is something that we've looked into, and we can certainly help you if this is something that you're interested in. Find the right solution for you and your family.
Yeah, and you'd mentioned that this is a good option to pair with a high deductible health plan, and I just wanted to touch on that real quickly. I have a high deductible health plan, my husband and I do, and we had some options, and we said, doesn't matter what the options are, this is the kind of plan we want because we know the importance of contributing to an HSA, and that's our number one priority. But when you do that, there are some downsides of that high deductible health plan. So it sounds like kind of a good marriage of those two things. So you're still getting the care that you need, and you are also able to contribute to that HSA and plan for the future, plan for your healthcare costs in retirement.
That's exactly right. The high deductible plans require you to, with the exception of your wellness visit every year, require you to pay up to your deductible before you have coverage for those doctor visits. So this can be a really nice alternative. Even if you don't contribute to an HSA, though, just having a lot of plans now are high deductible. So it's a way to potentially save money, still have access to the care that you need, and we think it's an area that people should be looking at.
Absolutely. We never want you to be in a scenario where you don't want to go to the doctor because it's going to cost you too much money. Got to stay healthy. So like Michael said, feel free to check out the description below, and we have a link if you want to check it out and just search for some direct primary care facilities in your area and see what your options are. If you have questions, feel free to leave us comments below. And if you haven't already, subscribe to our channel and click the notification bell so you know when we come out with new videos.